Hello friends, I'm Dr. Shubhdeep Bhattacharya. I'm working as an infertility consultant at Indira IVF, Patel Nagar, New Delhi. Today I'm here to discuss with you all a very important and pertinent topic on why does IVF cycle fail, what are its causes, and how to deal with it. But before moving ahead with our today's topic of discussion, I expect that all of you are following the principles that have been advised by the authorities in today's troubled times. We all know we are sailing through a very troubled time with this pandemic of COVID-19 around us. Although the infection has been slowing down and the number of cases have been falling considerably in our country, and the vaccination drive has also picked up, but still we have to exercise caution so that we can keep this pandemic under check. Therefore, always remember to wear a mask, follow the principles of hand hygiene, and stay away from crowded places and maintain the principles of physical distancing. So, all these things should be kept in mind. So, we move ahead with our today's topic of discussion. You all can reach out to me with your reports, and I can guide you after going through your reports what kind of treatment you can avail of. You can reach out to me with your reports on the number that is flashing on your screen on the lower side of the screen. You can send as WhatsApp or as an email attachment to the contact details that has been sent, that is being shown on your screen. So let's start with today's topic of our discussion. Why does an IVF cycle fail? Now, this term, failure of an IVF cycle, is quite frustrating as well as disappointing for the patient. And the first question that patients usually ask me is, why has the IVF cycle failed? So there are various factors because of which an IVF cycle can fail. It can be divided into embryonic factors, uterine factors, immunological factors, infective factors, as well as unexplained factors. Now, we shall discuss each of them one by one. What do we mean by embryonic factors? In certain conditions, it may be because of the female's poor ovarian reserve or poor oocyte quality, or it could be because of certain issues in the sperms of the male, or it could be because of certain faulty cultural conditions that we are not able to get good quality embryos. There are certain parameters which have been devised morphologically as well as by their growth rates, and certain category of embryos are only considered as good quality embryos. So if we are transferring or going ahead with an ET with a good quality embryo, the chances of conception would be maximum. Whereas if we are not able to get a sufficiently good quality embryo in such a case, then the chances of pregnancy also becomes quite slim. So the first and foremost reason for not being able to achieve a pregnancy in an IVF cycle would be failure to get a good quality, sufficiently good quality embryo. The second factor is the uterine factor. So we can consider the embryo to be a keene of a seed and the uterus to be a keene of the soil. So if we have got a good seed but we do not have a sufficiently fertile soil, then the plant wouldn't grow, the embryo wouldn't develop. So if the uterus is not, uterine lining, especially the endometrium, is not optimum, and we are not able to get a good quality endometrial lining, then the pregnancy might not be there. So what could be the reasons for that? Endometrial lining can be improper because of the presence of adhesions or synechiae. It could be because of presence of underlying infections like tuberculosis, etc. It could be post certain procedures like repeated dilatation and curettage DNCs, or it could be because of some congenital conditions also, because of which the endometrium is faulty. And because of all these reasons, even though we are transferring a sufficiently good quality embryo, it is not able to implant, and so there is no pregnancy. And in certain cases, if the endometrium is deficient, in certain cases there could be pregnancy, but still it might not grow and it might result in abortions. So this could be the second important factor. The third important factor is immunological. So many a times we see good quality embryos being transferred into a sufficiently good endometrium, but still no pregnancy is there. And certain females have this tendency of not being able to achieve pregnancy even after repeated IVF cycles, or a certain subset of this patients also has a tendency of repeatedly aborting pregnancies in early trimester. So this subset of population typically has certain underlying immunological cause. To understand this, we can easily take the example of any type of organ transplant. You have all heard the name of renal transplant or bone marrow transplant. We all know that transplant can be accepted or rejected by the recipient's body. Similarly, the embryo can also be considered to be an implant into the female's body. And because if the female's immunological system is on an overdrive, or it is repeatedly rejecting the embryos, in such a condition implantation would not occur and pregnancy would not happen. So there are certain ways to deal with this factor also. This immunological factor is quite vague or abstract, and it's quite tedious to identify it, and also the treatment modalities are also very new and obscure, but they are slowly coming up, and gradually we are able to know very new facts and therapies that are available in this regard, and we are going ahead with it. The fourth parameter that usually plays a role in recurrent IV failures or IV failures would be the infective one. Sometimes there could be underlying infective etiology. The patient might have had certain infection within the endometrial lining or within the genital tract, or the patient might have had systemic infection in the form of fever and all, which she might not have noticed or might have hidden from us. So because if there is an infective process in the body, the implantation would be hampered. So this is an important cause of not being able to achieve infection, particularly in India. A very important cause of infection is tuberculosis. Underlying or subclinical chronic infection, especially tuberculosis, plays an important role in the etiology of infertility in India. I would again like to remind you that you can reach out to me with all your reports on the number that is flashing on the bottom of the screen, and I shall go through the reports, advise you accordingly regarding the treatment part. So, going ahead with our discussion, the last part, that is the last etiology of an IV failure, would be unexplained. Many times we have made the couple undergo a battery of tests in order to find out the cause of IV failure, but still we are not able to find anything substantial. We might not find any of the reasons that I have already mentioned through this talk, and it becomes quite a dilemma for the patient also and the doctor also, that how to treat and what to treat. So this category of patients are classified into those who have an unexplained factor of an IVF failure. In most of the cases, the treatment is just to move ahead with tender loving care for this couple, because no specific therapy usually exists for this subset of patients. And usually as the couple proceeds ahead with a number of cycles of treatment, they are able to achieve pregnancy, because the cumulative pregnancy rate in such cases usually has a good value. So we have discussed most of the common causes of having an IVF cycle failure, and what are the treatment options available. I'll just mention them briefly also. And before going ahead with it, I would like to remind you again that you can reach out to me with your reports for further treatment guidance, and you can reach out to me on the contact details that are being flashed on the screen, and advice would be given regarding your treatment. So regarding the treatment part, if it is an embryonic factor, we have various modifications, like culture techniques can be modified, the stimulation techniques can be modified, ICSI can be done, extended culture systems can be implemented, and using all these things, a good quality embryo or a better quality embryo can be selected so as to obtain a better implantation rate. Secondly, to deal with the uterine factor, we have various techniques, like we can go for a hysteroscopy, which is endoscopic examination of the interior of the uterus, and we can also go for certain therapies which are available for treatment of thin endometrium. We can go for PRP therapy. We can go for some hormonal injections like granulocyte colony stimulating factor injections that improve the endometrium. And regarding the immunological part, various immunological therapies are available now in the form of intralipid therapy, immunoglobulin therapy, or lymphocyte immunotransmission therapy. All these therapies have been implicated in the treatment of the immunological factor. And in case of the infective factor, if it gets detected, specific antibiotic therapies or anti-germicidal therapies are initiated so as to treat the infection and go ahead accordingly. In case of the unexplained factor, usually a mixture of all these regimens is used along with tender loving care for the couple so as to give them the adequate psychological support, and also so that the treatment is moved ahead adequately. So, in brief, we have discussed the various factors of IVF, having an IVF failure, and what to do and what are the options available for that. At the end, I would again like to remind you of all the important principles of dealing with this pandemic, that is, wearing a mask compulsorily, maintaining the principles of physical distancing, and also following the principles of hand hygiene. I hope you will stay healthy, stay safe. Thank you.